Yeah, no wonder. There seems to be a very, like you rightly said, dark read in terms of the emotions and the heaviness that it carries. Nonetheless, the way you have narrated it was really, really nice. And yeah, I would like the forum to be open for questions. Let's go with the other members first. I would like to give my views.
Itika, how did you come across this book? What has prompted you to read this book? Who is it recommended?
No, actually, I found this in the little library we have here. Like it's a book stand kind of a thing in the park where everyone puts their books. It is not lending. We can get the book and read it. We can choose to return it or not. We can put our own book. Like it is like if you have more books in your house that you have read, you are loaning it to the community. You are giving it back to the community. That kind of thing. I found this and I was intrigued by the font. This is like this. So I thought, let me give it a try. I read the description at the back and I was like, okay, let me try. So
I'm
that's how
doing
I got hold of this book.
Yeah, sorry. Yeah, go ahead.
You going to details of porphyria?
Yeah, sure. Porphyria is a, let me read from Wikipedia. That would be authentic and yeah. So it is a group of liver disorders in which substances called porphyrins build up in the body, negatively affecting the skin or nervous system. So if it is skin, you're advised to stay out of sunlight and you're advised to take certain precautions that won't expose your skin to the extreme. So yeah, if it is a nervous system, you can.
Okay.
Okay. Go ahead.
I can't hear you.
Yeah, go ahead, Keerthy. I think he's specifying the one which is related to skin, if I'm not wrong.
Oh, okay.
Among the
so
two
if it is nervous system, you will have various symptoms like you will have an attack once and then you can either get affected totally or it will just pass with one attack like it did for Paula's father. This is in 1992 and there was no proper treatment for this. Nobody knew what to do with porphyria except take scans and monitor the nervous system of the patient affected. So in the book, she expresses doubt that some kind of a medicine might have reacted adversely with her system and it caused the disease to progress very quickly and affect her whole body. So she didn't know whether it was the medicines, the negligence of the doctors, or the disease itself what caused the death of her daughter. So the book is divided into two parts. First part is in Spain hospitals. She treats her the daughter lives in Spain with her husband and they admit her to a hospital and she gets treated over there. But later, Allende moved to California in her 40s. So she wants to take her back over there and care for her over there in California in her own home. So she takes her back in a very careful manner in the flight. And from then on, it is inside the house of Allende's son where she cares for Paula. So that is another part. So,
right.
It's most common in European countries.
Porphyria?
Yeah, porphyria.
Can this be cured?
In European countries, here it is also present, but very sporadic. You don't see many porphyria cases. Ultimately, no medicine has been discovered till now, but if somebody has got porphyria, it's not manifested straight away. Suppose you give some antibiotics, anticonvulsants, antipyretics, that will be the trigger point. So, doctor, if he is unaware of the patient suffering from porphyria, it's not diagnosed. Suppose he prescribes antibiotic, automatically porphyria gets precipitated, and then that will be hell for the patient. So, porphyria contraindicated drugs are many. Tetracyclines, ampicillin, so many drugs are there. Every day the drug list keeps on growing.
So there is no cure for this.
Is there? You mean to say that it cannot be cured?
It cannot be cured.
Yeah,
It goes down the
usually it cannot be cured of a person's
only
system.
maintenance.
The only solution would be to transplant the liver, I guess, like, because it affects the liver.
That is the cause of porphyria, madam.
Yeah, I mean, what she's trying to say is,
Porphyrin produced in the blood are not taken care by the liver.
no, but does the liver transplant help? That's the question.
Not very much.
Not very much. Okay. Okay. Right. On another note, yeah, yes, Navneet. Yes, Navnath.
Okay. Keerthy garu, wonderful book review. You do not need a PowerPoint presentation to present this book. Really liked it. And it's a beautiful meditation on death. I wonder if there are any books in Indian setting about the same topic, wherein relatives of a patient are describing their experiences and the phase they are going through. Are there any? Which one, sir? Okay, is it a Telugu book?
Yes.
Telugu book. Yeah. If you want to read in English, you got Promise by Daniel Steele.
Okay, so please drop it into the group so that.
Fever by Robin Cook.
Okay.
They are similar to this.
Okay.
But there will be some drama there. Here there is no drama, only suffering and human emotions. And well done, Keerthy. Wonderful.
Okay.
Thank you.
Yeah.
Thank you, Keerthy garu.
I have this very relevant point to what Keerthy was speaking today. This is in terms of the psychological aspect of how they say it's called compassion fatigue. So this is described, this is a term which is used for people who are the caregivers of people who are having diseases which are like this, especially they call in hospices and all, wherein terminal illnesses like this, wherein people have to suffer it through the life. These kinds of diseases are when they are caregivers who are taking care of very close members. There is something called compassion fatigue that is connected to, very much connected to them. I would request the members to have a little bit of, search for themselves, because see, it is a concept which talks about basically how a person, like Keerthy was talking about, how heavy it gets when especially a very close relative of you is suffering so much and you have to be a continuous caregiver without having to get any kind of emotion or any kind of feeling back from them. It is extremely taxing. This is not a small thing at all. In fact, people who are professionals also find it difficult. So imagine the position of a mother in this context. So it is not at all easy. In fact, that is in fact why I thought I should bring this concept up here, the compassion fatigue part. So excellent, Keerthy. I really love the part in which you have picked up those places where it is relevant, especially if you can share some more quotes from this book, it will be great, because as I see it, compared to the earlier book, this is more connected with emotions and how the dynamics go within the family and deeper aspects. So the quotations will perhaps bring out the more specific nuances of feelings between the mother and the child and how the mother is feeling and things like that. So I would appreciate if you can share some more quotes that touched your heart.
Request Keerthy to share the cover of the book.
Yeah.
Cover of, so that we can get one copy here, so that we can also go through the same type of emotional ride.
I am somewhere. Yeah. I'm somewhere guilty, Dr. Garu. I'm somewhere guilty in changing the cover, because I requested her if the other cover can be shared. She agreed to it. But then I think I'm totally with you. She got perhaps attracted to that cover, and then she went into reading it. So please do share whatever is requested.
Sure, yeah, definitely. Yeah.
Of late, what I'm trying to tell you is, more number of patients are dying of cancer than any other thing. Because they are overliving, they are living beyond a certain age, like 75, 80 or something like that, where the cancer is trying to catch up them. And then those people are suffering like anything, and then they're putting a lot of what they call stress to the entire family. So we just don't know when the cancer will spread, and it relentlessly spread despite we give the best of the best treatment, chemotherapy, radiotherapy, all these things. those things will keep on killing more the patient than actually the cancer. So cancer is nothing but unusual proliferation of the normal cells. So any drug which you give cannot distinguish between a normal cell and a cancer cell, because any multiplying cell, it attracts the radiation or chemo. So the multiplying cells are there in the bone marrow, the hair, and etc. Those places. So you lose the hair, and the bone marrow gets suppressed, and you suffer from anemia and a lot of immunity problems. Where you get secondary infection and you die.
Right.
So cancer is one of the important things nowadays. So many people. So as Radhika was trying to go the other day, she wanted to visit such kind of hospital once. I said it is very difficult, because we face every day so many people who are having terminal cancer. They want to live, and we cannot tell them the actual that you will improve, sir, no problem. This is working, and that is working, and such kind of nonsense we keep on. We're forced to tell them that, just to make them feel happy.
Sure. In fact, my this just since he has broached about this conversation, my point has come wherein I was working with one of the top hospitals in India, the CMC, it is called Christian Medical College in Vellore. As a counselor, in fact, in the psychology department, I was going and I was counseling a lot of patients, and my department has been pediatrics and oncology, wherein a lot of children I have seen them suffer with cancer and all those things and other things. So it was not at all easy for me to, at the same time, I was able to, just by me standing there were many patients who came and they just broke down. It was very, life-changing experience for me also, because I have not been in the field as Dr. Garu has been all his life. So I understand from where he's coming from in terms of cautioning me about the kind of effects that I might have by exposing myself to these kinds of situations. It's very traumatic. Some of the babies are lying in a position where 10 pipes are all around. It's not even 10 months old, and then the very sight of it is extremely devastating. And to be able to go there and to stand by the side of the caregiver and to be able to talk with them, more than talking, it's of course we have a specific skills in which we are supposed to do the therapy and all that. That is the technical part of it, which I have done. However, my own learning experience has been very humbling all through the 2 months that I have been there. So in that context, I thought maybe I could just visit some more, and that's where this conversation has come, just for the others to have an idea about why this has come. Right. So with that, I think I'll go ahead. Thank you so much, Keerthy, again, for this, bringing in this book and this conversations here. See, like I said, since